Hey, I'm Josh Knowles. Welcome to Ask Me Anything. I'm a cardiologist and geneticist at Stanford University, and I'm also the chief research advisor and member of the board of directors for the Family Heart Foundation. Let's get to your questions. This is a great question to start with, and I'm delighted that people are asking these questions. The most important tests to get at your heart health certainly include knowing your cholesterol levels, your lipid panel, your standard lipid panel. It's emerging that knowing your lipoprotein A can have important implications for many individuals. Certainly, you should know other cardiac risk factors like whether you have high blood pressure or diabetes. And although it's not a test, knowing your family history is really critically important. Asking your relatives, your parents, your grandparents, what's passed on in the family is really important because, as we know, family history is not a diagnosis. This is also a really good question. We know that having high lipoprotein A on a background of FH is a very large risk factor for heart disease. And certainly it's standard of care to measure lipoprotein A if you have familial hypercholesterolemia. That's recommended in all the national and international guidelines. It is not a guarantee that she will have high lipoprotein A. Lipoprotein A is inherited like blood group. The level of her lipoprotein A will be determined by the gene that she inherited from mom, plus the gene that she got from dad. So it's possible that she got low or normal LPA genes from both parents, in which case her lipoprotein A might be normal. This is a really important and actually quite complex and nuanced question. 10 years ago, if you had asked me this question, I would have said unequivocally, no, you can't, if your child has FH, then they must have inherited the gene from you. However, we now know that some individuals have the gene for familial hypercholesterolemia, but do not manifest high cholesterol levels because they have other protective genes. But when those are passed on to the child might inherit the FH gene, but not the other protective genes, and therefore she might have high cholesterol levels. The situation for lipoprotein A is a little bit different. Lipoprotein A levels are determined by the gene that you get from your parents, and your child's gene, lipoprotein A level will be determined by the genes that she gets from her parents, both the mother and the father. And so a parent can have high lipoprotein A and not pass it on to the child, or the parent can have normal lipoprotein A and the child can have high lipoprotein A. Yeah, this is a good question. Can FH come on later in life? And this is also a nuanced and complex question, and there's several issues that need to be unpacked here. First of all, children have lower cholesterol levels than adults, and a quote, quote, normal adult level would be high for a child. So if the child's LDL cholesterol level is normal, which is, say, for instance, less than 100 milligrams per deciliter for a child, it's not impossible, but it's quite unlikely that they will have familial hypercholesterolemia level LDLs later in life. However, if a child's LDL is 130, before age 12, before age 10, before age 8, that's quite abnormal for a child and could very well manifest later in life. So it's really important to know your cholesterol levels, and it's important to check them both in adulthood and if you're at risk in childhood. Now, there is some controversy about measuring cholesterol levels in childhood, and certainly the American Academy of Pediatrics recommends that all children should have their cholesterol checked at least once so that they can be prepared, especially if there's a family history. This is critically important. It's often not done, Most children do not have their cholesterols measured, and that's something that we're really quite focused on at the Family Heart Foundation. We're really pleased that the pediatrician had your children tested and you agreed to have your children tested for familial hypercholesterolemia, because early diagnosis and timely treatment can massively offset the cardiovascular risk. We know that the atherosclerosis, the coronary disease that develops in familial hypercholesterolemia, is due to a lifelong burden of high LDL cholesterol. And the earlier that we can intervene, the more likely it is that we can offset that risk. We know this from large longitudinal studies in several countries, that if you start lipid-lowering therapy in childhood, you can basically completely get rid of the long-term risk from familial hypercholesterolemia. The reason that for most people with FH, that is children with heterozygous FH, we usually recommend treatment after age 8 is because that's when the statin trials were done. That's the earliest age in which they've been formally tested. If the children have homozygous FH, that's a bit of a different story, and those children start lipid-lowering therapy, including very aggressive lipid-lowering therapy, much earlier than age 8. It is important to know this. The earlier that we can intervene by many different modalities, the better the kids will be. So for instance, making sure that the kids eat healthy diets that are low in saturated fat, making sure that the kids are very active and doing extracurricular activities to get their bodies moving and maintain healthy fitness levels is really critically important. So early knowledge is power, and by that knowledge, we can change the outcome of this condition. Thank you for that question. The question is, if you have high lipoprotein A, could your parents have high lipoprotein A even though they don't have heart disease? And there's a few things that need to be unpacked here. First, they could certainly have high lipoprotein A, but not have heart disease. We know that having high lipoprotein A, while it increases your risk, does not necessarily determine your destiny. It's one of many risk factors for heart disease. So it's important to know the levels. But just because they have a high lipoprotein A does not necessarily mean they have coronary artery disease. They might be protected by having low LDL cholesterol, low blood pressure, not having diabetes, not smoking, and maintaining healthy lifestyles, etc. But the other part to that question is, can you inherit high lipoprotein A, but your parents have normal lipoprotein A? And that actually is also possible, because your level of lipoprotein A is determined by the gene that you got from mom, plus the gene you got from dad, whereas their lipoprotein A levels are determined by the genes that they got from their parents. And so it's possible that they passed on to you, each passed on to you a gene leading to high lipoprotein A, whereas they themselves might only have genes that predispose them to low or medium lipoprotein A. So this is a really important thing to understand. We know that certain lipid-lowering therapies, including the statins, dramatically lower LDL cholesterol and massively offset the risk for coronary artery disease and heart attacks and strokes. We also know that in some cases, they mildly or modestly raise the lipoprotein A level. Raising the lipoprotein A level by, a few percentage is common. Raising it by as much as was addressed in this question is extremely uncommon, and we should really think about whether there's something else going on in the labs that were performed. But the important thing to understand is that lowering LDL cholesterol with statins dramatically offsets the risk, both from the high LDL and from the high lipoprotein A. It's really critically important, especially if you have high lipoprotein A levels, to get your LDL well controlled and control your other risk factors, like your blood pressure, like your fitness level, like your eating habits. And all of those things will dramatically offset that risk from having high lipoprotein A while we await the therapies that are currently in development. So we're all anxiously awaiting the new medications to lower lipoprotein A. We do think that they'll be available relatively soon, and especially will have been tested in high-risk patients with prior heart attacks and strokes. What do we do in the interim? And I think it's really important to realize that we have a lot of things we can do. Dramatically lowering LDL cholesterol really offsets the risk from the high lipoprotein A. Making sure your blood pressure is under control, making sure you're exercising and have good fitness levels is really important. What about aspirin? That really depends on the particulars of your case and each individual's case. It depends on whether you've had a prior heart attack or stroke. It depends on whether there's evidence of coronary calcification or other subclinical measures of atherosclerosis. It depends a little bit on your family history. It depends on the level of lipoprotein A and your other risk factors. That really needs to be a very individualized decision with your healthcare provider. There is a supplement, niacin, that has been around for a long time that does lower lipoprotein A a little bit. It's really quite unclear about in the modern era whether adding niacin to other effective treatments lowers risk, and in the largest studies, adding niacin to statins did not show benefit, although it hasn't really been teased out completely in patients with high lipoprotein A, but it's generally used very infrequently. There are not other supplements that I know of that are highly beneficial, and so really the key is control all of the other things you can control right now, and take comfort in the fact that controlling those risk factors does offset to a great extent your risk from high lipoprotein A. Yeah, should you be more worried about hemoglobin A1C or LDL cholesterol if you have prediabetes or diabetes? And this is something that's near and dear to my heart. We study this quite a bit in our laboratory. And the question is getting at the fact that LDL lowering therapies do sometimes increase the risk very slightly of diabetes. And I think we can't sweep that under the rug. There's a very small increased risk for diabetes in those that are pre-diabetic, almost diabetic. They can get slightly pushed toward the diabetic range by taking lipid-lowering therapies. However, this is mostly seen in individuals that are a little bit overweight or insulin resistant. And so one of the key things to do is to make sure that you're maintaining normal fitness, maintaining a fitness regimen, maintaining a normal body weight, etc. However, the most important thing to understand is that the risk of diabetes is very small from taking lipid-lowering therapies, while the decreased risk for heart attacks is very large. You massively decrease the risk for heart attacks, strokes, and other cardiovascular disease, and you very slightly increase the risk for diabetes or abnormal glucose metabolism. And there are now many effective therapies to help control that risk for diabetes. So we never want people to stop their lipid-lowering therapy if they need it because they have familial hypercholesterolemia or high lipoprotein A, because they're worried about the diabetes risk. We have a lot of things that we can do to offset that risk. And so don't be afraid to lower your heart disease risk with statins or other lipid-lowering therapies. This is a question that gets to the heart of why the Family Heart Foundation exists, why it was founded, to try to raise the awareness of familial hypercholesterolemia, high lipoprotein A, both in the general population and with healthcare providers. And while we've made a lot of headway, we still have a lot of work to do. You can help educate your healthcare provider. You can point them to the resources of the Family Heart Foundation to raise their awareness. I tell you, I give lectures to medical students, to physicians, to healthcare providers, and sometimes they're quite surprised to learn how common familial hypercholesterolemia and high lipoprotein A are, the risks that it entails, and what we can do to lower that risk. So keep advocating for yourself, keep pushing for the therapies that you need, especially with that family history and those values, and seek resources and support from those around you in your community. If you continue to run into roadblocks, the Family Heart Foundation has a wonderful resource of healthcare providers around the country, around the world, that are taking this very seriously. And it's an interactive map, and you can get information about people that really understand the risks and the benefits of therapy. Thank you so much for your insightful questions. I hope this has been helpful for you. There's a lot more information out there, especially at our website, familyheart.org. If you have additional questions that you can't find there, please contact our care navigators. You can actually speak to a real life human about your particular needs. There are resources to get information, not only for you, but for your healthcare provider. And we're here to support you in your journey if you have familial hypercholesterolemia or high lipoprotein A. Thank you so much.